Hi there, this is Michael King, and today we are going to answer the top questions that patients have about laser vision correction. And so the first question that patients have is, what is the recovery time? And so what I'd like to do to answer this question is kind of start from the actual procedure itself and then carry you through what the first couple of days are going to be like. So after the procedure is done, I would say the first 4 to 6 hours of recovery is really going to be where you want to go home and have a nap, and definitely take a couple of ibuprofen or Advil, whatever makes the most sense for you. But that first 4 to 6 hours, it feels like an itchy, scratchy, grainy feeling in your eye. If you've had PRK, there might be a little bit more discomfort, and your surgeon should be able to kind of give you a little bit of medicine for that as well. So after that first 4 to 6 hours and you've had that nap, then later on that night and the next morning is when you should get a major improvement in your vision. And so most people after that 1 day visit, which is the day after your procedure, they should be able to drive at that point and after LASIK. So PRK may take a few more days after that. And so with respect to fluctuations in your vision, I always say to patients that it's possible for the first couple weeks there might be some ups and downs of your vision, totally normal. Make sure you use a lot of the eye drops as well. So that kind of covers on the recovery time. The second question that patients ask is it permanent? Yes, LASIK is a permanent procedure, and our goal is that for you to only have one procedure. As much as we'd love to be able to see you, really this is a procedure we'd love to have it only done once for you. That being said, I would say nationwide 5 to maybe 7% of the time patients choose to, or actually would be better served by having a second correction. That's called an enhancement. Doesn't mean that anything was wrong during the actual treatment itself. It just means, we're not grinding lenses in a lab. What we're doing is we're reshaping the cornea. And so because of that, everyone's eyes heal differently. So if you have a very, very strong prescription or a lot of astigmatism, sometimes it's a little bit more persistent. It takes maybe a second treatment. So definitely it's something that you want to be educated on when you come in for that initial consult. But LASIK, for the vast majority of people, it is a permanent procedure. The next question is, what is the difference between LASIK and PRK? So what LASIK is if this is your eye, LASIK is the process of creating a LASIK flap with a little a laser, lifting that flap and doing the treatment, and then putting that flap back over. PRK is different. So this again, if this is your cornea, we use a little solution to dissolve, kind of loosen and slough away the surface cells of your cornea. And then we do the laser treatment itself. And then what we do is we put a protective contact lens on and some other drops on for about 5 to 7 days, depending upon how your eyes heal. Mostly, I would say that patients choose to or have laser vision correction done with the LASIK way, but sometimes a patient needs to have PRK because maybe they have a very highly active lifestyle, maybe they're in martial arts, maybe they're in the military. There's a lot of different reasons. Both are phenomenal procedures. LASIK takes less time for the recovery, but PRKs, again, it's a phenomenal procedure too. So the next question is LASIK affordable? Absolutely. And so, having been in this industry for over 12 years, here's what I can tell you. There are going to be some practices that advertise an extremely low price. I've seen everything from $250 to $500 an eye. The honest truth is that most of the time you have to have an extremely small prescription to be able to qualify for that pricing. So the average price that you should expect to pay, I would say, is between $1,800 or $1,900 per eye to like $2,500, $2,600 per eye. That's for the best technology and also having it done by a highly reputable practice. This is your eyes we're talking about, so you want to make sure you're having it done by a practice that's very transparent and straightforward when it comes to how their pricing works. With that being said, affordability also can be handled through awesome financing programs. So zero money down, 0% interest financing options, and kind of spreading that over a long period of time. For the most part, I'd say a couple of years. So check in with our practice and we'll be able to give you a bit more details about that as well. The next question is LASIK safe? That's the fifth question. LASIK is one of the, if not the safest elective procedure in the world today. And so LASIK's really come a long way in the sense that now there's just phenomenal eye trackers during the actual treatment. The initial scans that we do during your initial consultation really gives us that fingerprint of your eye so that we just have a very exact treatment. In the history of LASIK, to my knowledge, there's no reported case of anybody ever going blind. It is just a incredibly safe procedure, and we're not going deep inside the eye. It's a very surface procedure, and so the results are just outstanding. And so hopefully this has been of service to you. Thank you so much for watching. If you have any other questions, just kind of post them below and I'll be able to answer them for you. Take care. Have a wonderful day. Bye-bye.